Welcome to the committee, Mr. Secretary. It's my intention not to raise my voice and to give you an opportunity to respond to an inquiry. I'm going to begin with long COVID. It shouldn't be a surprise to you. During each of our meetings, we've discussed my interest in making sure our government does its part to address this challenge, which afflicts, by most recent estimates, over 20 million Americans. They have been diagnosed. There are a number of others we know that go undiagnosed. Over 400 million people worldwide suffer from this at a cost of $1 trillion a year, which is roughly 1% of global GDP. This, we know, has had impacts on participation in the workforce, therefore our own GDP. So it's serious on a number of fronts. It's my hope we can come up with some therapeutics for this condition. One of the real barriers to that is seeing that we are able to launch more clinical trials. I want to get your update on how the clinical trials are going, what plans you might have in the works to increase the number of clinical trials as it pertains to long COVID.
Yeah, Senator, there was a project funded, a long COVID project at NIH. There was a huge amount of money spent on it. It yielded nothing.
I agree with that.
Right. And I think you know that we are doing now a different approach. We're launching a long COVID consortium. We're bringing together the best doctors in the country who have developed reputations for being able to treat long COVID. And one of them is a doctor that actually...
Dr. Bruce Patterson.
Yeah, Bruce Patterson, and then Dr. Jordan Vaughn, also from Florida. There's a number of them who are doing spectacular things where patients are reporting extraordinary progress. We want to get them all involved, all in one room. We want to identify the protocols that are working. This is something that did not happen during COVID. It was all ivory tower science, and the doctors who are on the ground were ignored. The same thing happened during the HIV crisis. Yes. And we're trying to do something different, which
so my time's limited. You mentioned ivory tower. And so that's a segue into a statistic that I've become familiar with over the years. It takes roughly 18 years for proven interventions, pharmacological or other types of medical interventions, to make their way out into the field. If we assume, I think a conservative estimate, 12 to 15 years until we have any really acceptable therapeutics for a long COVID, that's a cheerful estimate. Plus the 18 years until it finds its way into clinical practice, people roughly my age will pass. Actuarially speaking, they will pass before there's any acceptable therapeutic. So we need to accelerate our current activities. Can you give me a couple of things you're going to do to ensure that we accelerate our development of therapeutics?
I mean, the best solution is the same kind of solutions that we should have been pursuing during COVID, which is off-the-shelf approved drugs for that are there already.
Yes.
So you don't have to go through.
It was recently reported that all the major pharma companies, I'm sorry if there's one good student exception, are serving as barriers to clinical trials. How can they repurpose?
It is bizarre that that's happening.
Okay, you're the Secretary of HHS. Will you be cracking down on this lack of cooperation?
Yes.
Thank you.
Yes.
Thank you so much. Will you also be exploring research partnerships with other countries, seeing as I've established this is a global challenge?
Yes.
Okay.
And that's what we should have done during HIV. It's what we should have done during COVID.
Yes. Will you also be exploring whether ARPA-H, which has different research of protocols than NIH? NIH is very good at what they do, but it takes them a really long time to prove things because of their rigorous process. ARPA is more practical, right? And so one could imagine ARPA-H tackling this challenge. Will you be encouraging?
We're absolutely open to that, Senator.
Okay. Will you be working with me and other members of the committee on your aggressive strategy as it continues
Yeah,
to
and
be
looking for good
articulated?
ideas everywhere.
Okay, the last thing I'd like to briefly touch on with the chairman's indulgence is just recognizing the president's leadership as it relates to the appropriate use of civil commitment to deal with homelessness challenges, mental health challenges, et cetera. He's taking a look at these practices. This can be a difficult conversation for so many of us, but I think it is worth considering whether government can play a more assertive role in helping people off the streets who have serious mental illness get off the streets, receive the sort of treatment they really need to be healthy. Can you provide some very brief thoughts on this topic, and maybe then I could follow up with a phone call?
On the topic of,
Civil commitment.
yeah,
We can follow up,
it's
Mr.
mainly
Secretary.
happening in the States, so I want to hear your ideas on it, if there's something that you think.
Yeah, I think the president said, you know, we ought to take a look at it. If there's somebody in 20-degree below zero
Yeah.
temperatures consistently in Washington, D.C., and they're believed to perhaps have mental health challenges, might we consider how to offer them care in
Yeah, and you know,
a
there's
controlled setting rather than allowing them to freeze to death? Might that be
Yeah.
humane as we
Well,
reconsider
perhaps the two of
application
you
of our
could
laws?
follow up on that with
Yeah.
each.
all right.